Hello everyone and thanks for watching today's video. Today I'm going to talk about a very common condition called irritable bowel syndrome. And I think most of us in our lifetime will at some time in our lifetime would have symptoms like these. I remember many years ago when I was a medical student, I used to have these symptoms and I think my trigger was stress and anxiety because of the exams that were coming. But anyway, this is our topic today. If you have any questions in the end, please leave them in the comment section. I'll be very happy to answer your questions. So, irritable bowel syndrome or IBS is more common in younger people as compared to older people because as we grow older, other problems start happening in our body, like things we talked about in my previous videos, like colitis, Crohn's disease, bowel cancer, polyps, um, and other conditions can take over these symptoms because these symptoms do overlap with other conditions, very similar to other conditions. So we are talking about younger people, and the commonest symptom they get is they get very bad abdominal cramps after, especially after eating. They feel very bloated, and some people say they feel so bloated that people say they are actually pregnant, and when they actually are not pregnant. And they can get constipation or diarrhea, and the diarrhea is very typical that after they eat they have an urge to rush to the toilet, so they have severe urgency, so much so that sometimes they can't even control it and get accidents before they get to the toilet. They also get excessive flatulence both ways, so they burp a lot and they pass wind a lot as well. So those are the main symptoms of irritable bowel syndrome. So, before we talk about what causes irritable bowel syndrome, it's very important to understand that all the symptoms we talked about in my previous slide, what causes them. So, if you look at the bowel with irritable bowel syndrome, normally when we eat or drink, the bowel will have a wave and which will go in a very systematic fashion from top of the gut to the bottom end of our gut, which pushes the food forwards. And when we eat from the top end, it be pushed forward like a wave towards our bottom end. However, if you take an example of a car, if we want to go forwards in a car, we put the car in the front gear and it starts driving forwards. If we want to go back, we put the car in the reverse gear, it goes back. But if somebody puts the car in the drive, goes forward, then reverse, goes back, front, back, front, back, and keep doing that, there won't be any forward motion or generally forward motion in the car. So same thing happens with the gut. Instead of when we eat or drink in some people, instead of going like a very nice wave, it goes in a very funny fashion. So it goes like this. So food that we eat, instead of going in one direction, it to's and fro's. So it goes forwards, backwards, forwards, backwards, forwards, backwards. And what it does, because food is in the stomach or in the intestine, it makes it bloat because food stays in there for much longer than normal. And what the bacteria in the gut do, which we all have in the gut, they make the food ferment. So it makes it rot. And when you know that if you rot something, you produce gas, and the gas makes tummy bloat. That's why patients say they feel like they are pregnant. Also, they pass lots of flatus both ends, so they are burping a lot, they're passing flatus a lot. And that's why they get diarrhea because the bowel is going like this, very nervous bowel, goes forwards and backwards. And sometimes, if the food can't go forwards completely, then they get bunged up, they get constipated. So, those are the main symptoms, and that was the reason. Now, what causes irritable bowel syndrome? The answer is basically, even in the 21st century, as doctors, we really do not know what causes irritable bowel syndrome. Maybe there are different causes for it, and in some people, there might be one cause as compared to the other, and in other people, it might be the second cause as compared to the first one. But in many people, I think it's the combination of several things which cause the symptoms. So, bacterial overgrowth might be one of the causes. We travel abroad, we pick up bacteria in our gut, we eat different things these days. Second thing is a very nervous bowel. So, the nerves which are contained in the lining of the stomach or in the lining of the intestine, they are not working normally because, as we mentioned before in my previous videos, the motor that makes our bowel go forwards are the nerves. And if those nerves are not working properly, then the bowel will not function normally. like in a wave in a very systematic fashion. Instead, it goes like this, goes like this, goes like this. And many of these people are very nervous people. They are anxious, they are nervous, or they are going through stress and anxiety in their life. Somebody might have passed away in the family, somebody might be very ill, or they're having stress at work or at home in their home life, and they get these symptoms. Many of these people have certain food insensitivities or sensitivities. So, certain types of food, and in my experience, the commonest type food is lactose, which is milk products, red meat, also gluten, so wheat, oats, etc., can give rise to symptoms of irritable bowel syndrome. However, everyone is different and everyone might have a different trigger, but just one needs to learn what the trigger is, and that is the only way of controlling a condition which really has no cure. So, what tests can be done to diagnose irritable bowel syndrome? There is no particular test to actually diagnose or rule out irritable bowel syndrome. Most of the tests that are done by doctors or specialists to confirm irritable bowel syndrome is basically aimed at ruling out other conditions. So, blood tests can be done to rule out celiac disease and other conditions, allergies. Stool tests can be done to rule out infections or inflammation of the bowel, like colitis or Crohn's disease. Colonoscopy or CT scan can be done to look into the bowel to make sure there is no other cause of symptoms like diverticulitis or colitis or bowel cancer. Food allergy tests can be done, and also bacterial overgrowth tests can be done. So all these tests are being done to make sure they are all normal. If all of them are normal and the patient still have symptoms of irritable bowel, then that is how it is diagnosed. What is the treatment for irritable bowel? The treatment of irritable bowel, like any other benign condition in our body, is how bad the symptoms are. If the symptoms are only mild, then no treatment is required. If, however, the symptoms are quite bad, then we should try and control those symptoms. The problem with irritable bowel is because we do not understand the cause for it, and in every patient the cause might be different. In some patients there might be more than one cause for the disease. Hence, the treatment does not always effectively control all the symptoms. It might make it better, so it's worth trying. So if somebody is bloated, then I do certainly recommend to them try some linseed oil. It improves the bloating, or try even probiotic tablets or probiotic drinks they can try with friendly bacteria. They will help with the bloating. Peppermint help, charcoal tablets help, and they all improve the bloating. If you have diarrhea, then I suggest reduce the amount of soluble fiber in your diet. Again, linseed oil will help, and antidiarrheal tablets if you're getting so much urgency that you have to rush to the toilet even when you're going out and it's affecting your quality of life. So taking antidiarrheal tablets will not do any harm. If one is constipated, then increasing the amount of soluble fiber will help. Linseed oil will help. And things like reducing the amount of sorbitol, which is a sugar which is usually present in certain types of fruits, that will definitely help. And there is a diet called FODMAP diet. Do a Google search on these. Basically, they are foods which include quite a few vegetables, cereals, and also fruit, which if we eat an excessive amount, because they're very difficult to digest with our by our digestive system, reducing that type of foods will improve our symptoms. So putting all those things together will definitely improve our symptoms. Also, in some people, the symptoms are so bad that they might even require some treatment, medical treatment, like tablets. And many of these treatments are aimed towards controlling the nerves. So there are treatments like amitriptyline, citalopram, which are given in depression as well. However, these drugs given in lower dose can control the nerves, the way our nerves work in the digestive system, and they sometimes do help. Patients who are very anxious or very, very nervous, going through stressful time, then cognitive behavior therapy will definitely help with it as well, which is, psychological treatment. So I do hope you found this video useful, and if you have these symptoms and if you have any questions to ask, please leave the question in the comments. I'll do my best to answer those questions. Thanks for watching.